So eliminate these hateful eight, but say somebody's been consuming them on a regular basis to this point. Their tissues, their fat tissues more specifically, are loaded with this inflammatory fat. What do we do other than not take in any more? Is there a way to speed up that process? Talk more about the timeline of how long it takes in a general sense for these to leave the body.
Yeah. So when our body fat contains, say, like 30% polyunsaturated fatty acid and normal is maybe 5 to 10%, it will take a number of years before it will go from high to normal. And during that time, if you start eating better, you're going to feel better way before it's all gone. Okay. But until it's all gone, that means you're going to be prone more to maybe some hangry, maybe having carb cravings, maybe having sugar cravings. You might still be insulin resistant for a lot of that time. But you will feel better. And somebody asked me this, just earlier today, like, how can I accelerate the process? And my thinking is, I'm not sure you want to accelerate the process. You want to feel good while you're going through the process. But if you accelerate the process, that means you're going to be forcing your cells to burn more PUFA, and that might be bad, right? So, and we do know that yo-yo dieters often end up, when they're basically doing exactly that. They're basically trying to accelerate the process of weight loss, which means that they're trying to they're effectively getting rid of more of that PUFA, but making their bodies burn it. But it damages their metabolism further, possibly, which is why so many of my patients have gone on exercise programs, gone on shake programs, lost a lot of weight, and then they come to find out that they've developed insulin resistance. Now they're pre-diabetic. They weren't before they started their program. How's that possible? Oxidative stress. Oxidative stress causes insulin resistance.
So what you're saying there is, if you were to lose weight too quickly, if your body is loaded with PUFAs, you could cause damage of those being expelled too quickly.
Yeah, because when they're not getting expelled, they're getting burned. I guess maybe that's the key point. The only way to get rid of them is to burn them off. And it's your mitochondria are going to be burning them. And, there is no detox pathway. I've spoken to scientists who study this stuff, and they say, no, these things, we can't get rid of them. It's not like other toxins that we can eliminate, like alcohol, right? We have a way to get rid of excess alcohol. Like, alcohol doesn't build up in our body tissues, but these polyunsaturates do build up in our body fat. And it's like any other fat. The only way to get rid of it is to burn it off. And so that's why I don't think we want to be forcing the issue there, because we gained it because our bodies didn't want to burn it off.
So we talked about before how the mitochondria, it's troublesome for them to burn the PUFAs. Just to clarify, because we're talking about now the fact that they do have to burn them to get rid of them. They can burn them, but they don't. I want you to get into the nuance there.
Well, it has to,
because before we made it sound like they couldn't be burned, and now we're saying that's how we do get rid of them. So is it just that they burn differently and it's not an efficient process? Get into the nuance there.
It's about the concentration, right? So the more that there is in our body fat, the more likely it is that there's going to be PUFA ending up in the mitochondria. So let's dial it back to the world without any seed oils or vegetable oils, and we have just something like 5% PUFA in our body fat, or even less. That PUFA is necessary for other things. Our bodies did not ever used to have to burn it, right? So just by the law of concentration, it won't make it into the mitochondria at a very high rate by the randomness, right? Only 1 in 20 of our fatty acids are a PUFA. So that means 19 out of 20 are going to be good for the mitochondria. And there might even be other regulatory mechanisms that keep it out. We don't know about those. But so, at that low concentration, 1 out of 20 or 5% of all fatty acids delivered, that's not a big problem. Still, always burning fat, using the mitochondria creates oxidative stress, right? So it's all a matter of nuance. There's always oxidative stress. Energy generation produces oxidative stress. That's why we have so many free radicals. But when we use the wrong fuel, it produces more oxidative stress. And the more of the wrong fuel that we use, the more of this excess oxidative stress is happening. So what we want to do is burn just a little bit of this high PUFA body fat every day. Not too much, not too little, right? So if we can keep it to a certain percentage where we're feeling okay, we don't feel, these hypoglycemia symptoms, then to me, that's the best way to know that we're doing all right. And, slow weight loss, right? You're going to lose weight because you're going to not snack so much, right? Most people, a lot of their weight comes from being hungry between meals and snacking, or being hangry at a meal and over ordering your meal. And then you've got this giant plate of food and you want to finish it off because you're trained to do that by your mother. So, so once you don't have so much hangry in your life, you can better regulate your meals and you will start to lose weight without even seemingly feeling like you're cutting calories, right? The average calorie intake is just excessive by a couple hundred calories every day. You dial that back and you burn just a little bit more of your body fat every day. That's the safest way to lose weight, gradually and slowly, and by making sure that you don't have hypoglycemia symptoms because you are tracking your pathologic hunger.
All right, so slow and steady when it comes to getting rid of these inflammatory fats. For somebody that is, say, 30% of their fat, I think you used that number.
Yeah.
Being made up of this, and they're really toxic at this point, how long will that stay in their system if they're on a slow and steady method? We've kind of talked about long period of time, years, but what are we looking at?
Well, no one really knows because, it's we're all just sort of guessing based on some radiation studies that were done before PUFA was in the blood supply that showed that that any given fatty acid in your body fat has a replacement time, a half-life of just about a year, a little over a year. That means that half of them will be replaced in a little over a year. That means all of them will be, most of them, 95% will be replaced in 4 half-lives, which is maybe 4 years. But different fatty acids get mobilized at different rates. Some stick around, some are like offered up and, can be utilized faster. So we don't know. It's all a guess. And it might be different based on genetics too. But I can tell you from what I've seen that it definitely takes at least 2 years. But most people do really start feeling so much better after just 6 months that they're okay with the slow weight loss. And I do start to see dramatic improvements in the insulin sensitivity. They don't become fully normal, but their other biomarkers all get good, right? Like they get lower triglycerides, they get elevated HDL, they get less high blood pressure or normalized blood pressure, and they start to lose fat from the worst places that are the most embarrassing, like right around our belly and under the chin. People have more energy. So, you just start feeling better. You can get off drugs. Actually, I just got a letter from somebody this morning or yesterday morning that said they were 900 pounds and on 22 drugs. And they had some surgery, that bariatric surgery, lost like 400 pounds. But when they started getting off PUFA and following the kind of diet I recommend, they got off the drugs. And then they also lost the rest of the weight. And now they're like 200 pounds, right? I mean, it's still a heavy person, but this is a person who was 900 pounds. So that they said that, what I hear from people is that what keeps them going is how good they feel.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Dark Calories really tells the story of the biggest scandal ever perpetrated on the American public by a medical organization. And this scandal has affected every American because it's changed how medicine is practiced.